order, we have Professor Becky Tago in the procession. Professor Undukweze Ezema, Professor Emmanuel, Professor Emmanuel, Dr. Uche Wobi, Dr. Edmond Osai, Professor Innocent Okoye, Professor Emmanuel Obiki, Dr. Weze S.O., Professor Silas Ufele, Dr. Enebe J.T., Dr. Udagu G.C., Dr. Odilinye Hilary, Dr. Nlewedim Paul, Dr. Isuka Emmanuel, Dr. Obiora Isuka Chile, Dr. I.J. Ibebuna, Professor Ifoma, Professor Emmanuel Ihim, Dr. J.O.T. Onya, Dr. Ifebi Osi, Professor Nene, Professor J.N. Wosu, Dr. U.N. Awuchekwa, Dr. Oli, Professor Agosie, Professor Obina, Dr. Miriam Juliet, Professor Basil, Professor Ba, Professor F.E. Echezie. Also in the procession we have Dr. Jude K. Ede, Dr. Ifoma Mecca, Professor Gladys also, Dr. OBSN, Professor Onyekulu Fidelix, Dr. Esther Ekwe, Professor Cyril Lim, Dr. C.D. Adobe Amuchis, Dr. Chioma, Professor Sylvester Wokedyuko, Professor Uchenna Ijoma, Professor Henrietta, Professor Ngozi Beziako, Professor BJC Omubere. Also we have Dr. Ago P.U., Dr. Wankwatsi O, Professor Ndokweze Ezema, Professor Florence Orabweze, Professor Oracle J.C. Eze, or Oracle Professor J.C. Eze, Dr. Ban Chidu, Professor Okechukwu Wampo, Professor A.U. Had, Professor C.B. Chijoke, Professor C.U. Wanigwe, Dr. O.R. Okwesili, Dr. George Ibu, Dr. U.O. Esumoke, Dr. Duru Augustine, Dr. Nikwe Obina, Dr. Arthur Idoko, Professor Val Ugu, Dr. Inogalu Emeka, Venerable Professor Christian Okafor. Past the Nobel lecturers. We also have Professor B.S.C. Uzochukwu, Professor Bad Anyehi, Professor Bon Anyehi, Dr. Dilibe Uchenna, Dr. Obioha KCE, Professor Chinwe V. Ukwe, Dr. Nneka Onyejaka, Dr. Uwezuoke, Professor Ike Basu, Senior Dr. Kate Umebieri, Dr. Charles Ibiok, Dr. Ezema Chibweze, Dr. Dean Ngozi, Professor Obiekwe Okoye. I can see Professor Florence Orabweze, Venerable Professor Ernest Owasigwe, Dr. T. Regina, Professor Obiekwe Okoye, Professor Ifoma, Professor Ifora Okoye, Dr. Neka, Dr. Isiamaka, Professor Ada Agaji, Professor M.A.C. Agaji, Dr. Suamaka Okoli, Dr. Brenda Watson, the Vice Chancellor and the Deputy Vice Chancellor. The national anthem, first stanza only. National anthem, first stanza only. The University of Nigeria song.
University of Nigeria,
While still standing, please permit me to introduce and call up to the podium Venerable Emeritus Professor Ernest Onwasigwe to please come give us the opening prayer.
Let us pray. Our gracious Father, we thank you for this great day. We thank you, Lord, for this day that you have blessed and hallowed. We pray that we rejoice and be glad in it. We thank you, gracious Lord, for joining mercies. We thank you, gracious Lord, for this day of celebration. Your blessings upon our brother. Gracious Lord, we pray that you disturb our mouth, that you bless the meditations of our heart, that they be acceptable unto you. For we pray in the name of the Father, and of the Son, and of the Holy Spirit.
Amen. We can all be seated. Thanks. Principal officers here present, distinguished academics, members of the Fourth Estate of the Realm, lions and lionesses, ladies and gentlemen, you're all welcome to this wonderful academic discourse. I'm tempted to say that I think the Faculty of Medicine is actually, or the College of Medicine, they're actually very partial. The hall is filled to its capacity. Please put your hands together for yourselves. Before we proceed, permit me to introduce to you the members of the high table. Today we have our Grand Commander in charge of this great institution here present. Ladies and gentlemen, please put your hands together for the Vice Chancellor, Professor Charles Arinze-Chukwu Igwe. Seated next to him is the Deputy Vice Chancellor, Enugu Campus, Professor Daniel Nwachukwu. Music department, I hope you're not partial. All right, we have a member of council present in our midst. Ladies and gentlemen, please put your hands together for Professor Obinna Onwujekwe, a council member. We also have another council member, Professor Kenneth Ofokansi. Please put your hands together for him. Ladies and gentlemen, please put your hands together for Emeritus Professor Nene Obianyo. Ladies and gentlemen, can you please put your hands together for the Dean of Faculty of Medical Sciences, Professor Ima Ejim. Allow me to introduce to you the man who has called us together here. All right, the 181st inaugural lecturer, the OKOCC that has gathered everyone together. Ladies and gentlemen, please put your hands together for Professor Cajetan Chigozie Onyedun, the Professor of Medicine and Pulmonology, UNN. He's here with his beautiful wife. You know, they say besides every successful man, there is a beautiful, successful woman. Ladies and gentlemen, please put your hands together for the wife of the inaugural lecturer, Onyedun Chidiebere, Yolanda. The Provost College of Medicine is also here. Before I introduce him, let me please introduce the past inaugural lecturers here present. Distinguished ladies and gentlemen, please put your hands together for Venerable Emeritus Professor Ernest Onwasigwe, former Provost, College of Medicine. Professor Chinwe Ukwe, past inaugural lecturer. Professor F.E. Ejezie, past inaugural lecturer. Professor J.N. Wosu, past inaugural lecturer. Professor Ifoma Olase, past inaugural lecturer. Professor Anthony Ikefuna, past inaugural lecturer. Professor Basil Ezanolowe, past inaugural lecturers. It's not easy reading the doctor's handwriting. It's almost as if they are giving a doctor's prescription here. Professor Uche Nawa, past inaugural lecturers. Professor B.S.C. Uzo Chuku, past inaugural lecturer. Professor Emmanuel Agowa, past inaugural lecturer. I know I saw Professor Bon Anyehe, past inaugural lecturer. Professor Obi Samuel, past inaugural lecturer. Professor Sylvester Nwokejuko, past inaugural lecturer. Professor Emmanuel Obikili, past inaugural lecturer. The Provost College of Medicine, Professor Uzo Ezegui. Please put your hands together for him. Professor Bansin Onwobere, past inaugural lecturer and past Provost College of Medicine. Please appreciate him specially. Professor F.O. Orabweze, my very own mommy. Please put your hands together for her. You're welcome, ma. Professor Oracle J.C. Eze, past inaugural lecturer. Venerable Professor Sam Ike, past inaugural lecturer. Professor Ifoma Enemo, Dean of Faculty of Law, the former DVC UNEC. Please put your hands together for her. Professor Chimdi Chuka Okosa, past inaugural lecturer. I love you too, ma. Professor Uzo Ezegui, past. I think I've called that before. All right, we'll move to recognizing our guests. Every other inaugural lecturer here that we didn't mention their name, you're all highly welcome. Please appreciate yourselves. We recognize you. Please put your hands together for yourselves. We recognize you. The Chief Medical Director, UNTH, is here. Ladies and gentlemen, can we please put our hands together for Professor Obina Onojugo? Please give us a wave. I'd like to recognize very specially the Onyedun family, the children, and the family in general. So please, if you hear your name, just give us a wave, because I can't specify which is which. We have Onyedun Adobe. I think this is these are the children. Onyedun Adobe, you're welcome. Please appreciate them. It's not easy. Put your hands together for them. Onyedun Obina, you're welcome. Onyedun Ogonna, you're welcome. And of course, you know, we've recognized the beautiful wife of the inaugural lecturer. So I'll go to Onyedun Onora, the brother of the inaugural lecturer. You're very welcome, sir. I have here one, is Inwigwe Pascal, brother. Please give us a wave. We have Onyedun Ifoma, Onyedun Ngozi, Onyedun Chizoba. Please just keep appreciating them. These are the family members of the inaugural lecturer, please. Onyedun Chidi, Onyedun Paul, and Unaka Raphael. You're all very welcome. Appreciate them, please. At this juncture, ladies and gentlemen, permit me to hand the microphone over to the chairman, Senate Ceremonials, who, by the way, I did not remember to recognize, is seated on the high table, Professor B.C. Wanguma. Please put your hands together for him.
Well, good afternoon, ladies and gentlemen, distinguished members of the Senate of the University of Nigeria, guests of the University of Nigeria. It's my pleasure, as always, to welcome you to the 181st Inaugural Lecture of the University of Nigeria. And today's will be presented by Professor Cajetan Chigozie Onyedun. And the topic, as we can see on the banner there, is Doctor, I have normal cough, an exegesis of normal and abnormal cough. My job is a simple one right this morning, but I've been bogged down by recognitions. Professor Ifoma Ezeago Gladys, Professor Mrs. Gladys Ozo, Professor Emmanuel Ezome. As you can imagine, it's going to be difficult to recognize all the distinguished men and women who have responded to our invitation this afternoon. But when it's time to do a vote of thanks, we will try as much as possible to capture even many more. And so at this point, may I most respectfully invite the chairman of the day, the Vice Chancellor, Professor Charles Igwe, to give the opening remarks.
Good afternoon, all. Please permit me to recognize all the principal officers of the University of Nigeria here present, distinguished council members of the University of Nigeria here present. I've also noticed the presence of former council members of the University of Nigeria here present, Provost of College of Medicine, the inaugural lecturer and his spouse, the university academics and the members of university administration, distinguished professors, past inaugural lecturers, the CMD of College of University of Nigeria Teaching Hospital, Enugu, heads of departments, ndi nze na ozo, ndi ichie, ndi lilu. At least I can see my teacher, Professor Obi Nwelego, Professor Obi Ezeobioma. I have seen him. I hope I've recognized all the Professor Emerita here present, my Lord spiritual and temporal, members of the fourth estate of the realm, great lions and lionesses, ladies and gentlemen. We all know this is becoming a regular event here at the university. But I think this one is special today because we are dealing with something we call normal. And it's also coinciding that I am here present today because by the time he was telling me about this inaugural lecture, I thought I wouldn't be around. But behold, even though I have pressing, functions to attend, but I had to at least show my face here. Why? Because Professor Onyedun is one of those professors, one of those few professors that will always want to hide their professorial status and pretend he's a normal person. There are people that carry their professorship on their forehead. And he is one of those friends that will never forget the way he started and the way he's moving. And I want to give God all the glory that we still have such people in our midst. I'm also here today. Because he's dealing with a topic that, for me, one of those things that made some of us run away from medicine. And the topic is, I have normal cough, and exegesis of normal and abnormal cough. And that reminds me of what happened to me many years ago. I visited my aunt in the village, and I was coughing. And I said, Mama, don't come near because I have this cough. He said, but I knew at least with my little elementary science, that something must have been behind that cough. A bacteria or one of those tiny, creatures that live in our body must have caused my cough. Even though some people will tell you that, you're not okay. So I am happy today that Professor Onyedun has summoned courage to deliver his lectures, inaugural lecture. Inaugural lecture is in our academic communities what tells us that this person has arrived and that something must have made him that professor he is. And I'm happy to know today that what made Onyedun, that I have also benefited at one time or the other, is coughing. Even though the younger ones today, I noticed the one they call music, they call cough. I don't know if I know the young ones say I will know the one I call cough. And when they dance it, they don't. I say, you now use. The music instrument is coughing. I hope you are not trying to play the music cough. So I'm happy today that Professor Onyedun has arrived. Something made him. And he dwelt on cough in his research, using cough as a research theme. And that is very, very important because even in some places, when the cough has degenerated into a very higher one. You know the one I'm talking about. The Igbo, that's why I like Igbo language. It has classification for all those ones. They don't call that one cough. They call it another thing. So I'm happy that people are also looking into that kind of ailment and that it is no more a problem. If you have cough now, that you can run to Professor Onyedun and tell him that you are coughing. And when he looks at your lungs, he will tell you what to do and what not to do. So, ladies and gentlemen, I plead and ask you that you sit back and listen to this academic guru. The Abo Nani Basuno Uchina Nwata deliver his inaugural lecture. Thank you very much.
Thank you very much. The Vice Chancellor has hinted rather slightly that he may not be here until the very end of the lecture. And so when that time comes and he's leaving, we would excuse him, the Vice Chancellor, and the power will automatically shift to the Deputy Vice Chancellor, Enugu campus. My pleasure at this point to invite the Dean of the Faculty of Medical Sciences to introduce and read a citation on the 181st Inaugural Lecturer. The Dean, please. Please, a round of applause for Professor Manuel.
The Vice Chancellor, University of Nigeria and Nsukka, Professor Charles Arize Chukwuigwe, the Deputy Vice Chancellor, the Provost, and other members of the High Table. It gives me pleasure to read a citation of my friend and confidant, Cajetan Chigozie Onyedun, who was born to two great teachers, late Mr. Simon Onyedun and late Mrs. Georgina Onyedun, at Eziosu village, Lilu, in Ihiala local government area. Cajetan is the second of 7 offspring from those parents. He started his primary education in 1973 at Lilu Central School, Lilu, and passed through 3 other primary schools before getting his first school leaving certificate, because being born to teachers, he was itinerant, moving around with his parents as they were posted from school to school. On his first day in primary school in 1973, he recited a momentous poem titled Twinkle, Twinkle, Little Star. And the confidence with which he recited that particular poem made the headmaster of the school to give him 1 year labor-free period, showing that he never did labor work throughout the time he was in school for that particular year. He completed his primary education at Lilu Primary School in 1978 and took the Anambra State Common Entrance Examination and made an aggregate of 38 and automatically was posted to Abbott Boys Secondary School where he started his secondary education in 1978. His stay at Abbott was very eventful. He was an all-rounder, participating in so many things. Cajetan was doing well in academics. He did well in sports, debate, drama, church activities, politics, and service delivery. At a time, he became the choir master. I became the chief sacristan in the school, but he refused to go to the seminary. Above all, he finished his West African school certificate exams and got 5 distinctions and 4 credits with a combination including further mathematics and history. You know, when somebody does history on one side and does additional maths on the other side, then something is, yes. In December 1983, he passed JAM and gained admission into the University of Nigeria to study medicine on merit. Nobody helped him. He didn't know anybody to get into medicine. I remember he was coming from a very village school. He had a memorable stay at the University of Nigeria, passing all his exams at first attempt, and graduated on the Dean's Merit List as the 3rd best graduating student in 1989. Of course, being in the Dean's List, he had to do his housemanship at the University of Nigeria and worked under such great teachers like Professor Martin Agaji as a house officer, Professor Bid Ibe, late Professor J.C. Azubike, Dr. Callistus Eze, as well as late Professor Uchenna Megafu. Like for most doctors, the journey into life started after housemanship. And in order to gain a surgical experience, he wanted to be a surgeon, even though he ended up in medicine. In order to gain surgical experience, he traveled to Kebbi State to go and learn surgery. If you've been in the north, you see that even nurses there do surgeries. So if you go there as a doctor, you learn a lot. We were doing thyroidectomy and doing amputations, even though the outcome sometimes was not very favorable. So he went on such a sojourn and stayed there for 3 months, gathered surgical experience, and eventually in 1991, he was posted to Kaduna State for his NYSC, where he worked at the pediatrics department of Ahmadu Bello University. Those in pediatrics will know Professor A.M. Akubo. He was my examiner in pediatrics. We dreaded the man then. Professor Onyedun worked under him as a house officer, as a medical officer. And by the time he was leaving, he had decided he was going to do pediatrics and even bought the very popular Nelson's textbook of pediatrics and was preparing for primaries. However, because of insecurity and not being sure of a very pensionable job in the north, he had to come down to the east and went into private practice. He first of all worked at 9th Mile at King's Hospital and Maternity, where he worked for 1 year before he moved to Imo State and worked at St. Kevin's Hospital, Amanachi, Ebenator, where he worked with and lived with his main man, Professor Uchenwaga, as well as one of his friends who was gruesomely murdered some time ago, Dr. Zenwa. His sojourn at Ebenator lasted a year and he was able to establish a private clinic in that place named Osu Clinics and Maternity, Osu Hitukwa, in 1994. Having acquired enough surgical and medical skills. Incidentally, Osu Hitukwa is his maternal home, and it was during his stay there that he met Chimde, his beautiful wife, in 1995. That meeting culminated in marriage on 13th April 1996. He later relocated to Olo in 1996 and briefly worked in a mission hospital, as well as in that particular hospital, something happened. He took over from Professor Sebastian Ekenze, one of our pediatric surgeons. And when Sebastian Ekenze was handing over as the dean of faculty, he also took over from him. So it was decreed in the past, and it has remained so up till now. The final choice of career path and journey was not easy because at St. Kevin's Hospital, he sat and passed for ECFMG exams then. Then it was called ECFMG, both step 1 and step 2 in 1993, because he wanted to go to America. However, he got an offer from Flushing Hospital, Medical City in New York, and went for visa interview. But unfortunately for him, I don't know which one he chose, whether fortunately or unfortunately, they denied him a visa to the US because they said there was no guarantee that he was going to come back to Nigeria after going to the US. And he was wondering how a 27-year-old guy could guarantee that he was coming back to Nigeria from the US. However, he really did not want to do residency in Nigeria, but his friends and classmates and colleagues kept on pressurizing him to do residency. And you know those his friends? Professor Waga, Professor Ekenze, Professor Ezegui, Professor Agowa, Professor Zome, Professor Yoke, Professor Biaeze, and Professor Adayaj. They insisted that he must do residency, and he eventually sat for fellowship. So he had a problem whether to go back to pediatrics or to go into surgery, having acquired surgical skills in private practice. But you can see all these people I called, none of them is a physician. So he didn't want to go to an area where his classmates were prevalent. So he chose to come into internal medicine, did his primary fellowship exams and passed at first attempt, and got space for residence at Nnamdi Azikiwe University Hospital, Nnewi, and UNTH. He took off at Nnewi, but eventually ended up at UNTH in the year 2002. He took both Part 1 and Part 2 fellowship exams at the West African College and passed both at first attempt, and became a fellow of the West African College of Physicians in the year 2007. Even at that, his plans to travel overseas never died down. But this time around, he chose to go to the UK. Cajetan took and passed both PLAB 1 and PLAB 2 exams in 2004 and 2005, and got full registration with the General Medical Council of the UK on April 15, 2008. He had clinical attachment and experience at the North Middlesex Hospital under late Dr. J.K. Omubalele, who was his teacher at the medical school. He also took and passed Part 1 MRCP UK examinations. However, on completing residency program, he was appointed a full-time hospital consultant at UNTH after a brief stint at FMC Umuahia. His career progression followed like his primary school and secondary school and university exams. He was appointed a lecturer 1 at the Faculty of Medical Sciences, University of Nigeria in June 2008, and rose to a senior lecturer on October 1, 2011, associate professor on October 1, 2014, and full professor on 1st of October 2017, without missing any day out in the line of promotion. Cajetan also was appointed the co-principal investigator for Harvard PEPFAR AIDS Prevention Initiative Nigeria site. That's the site at UNTH, a position he has held up to today. He has served on several committees and subcommittees of the society at large, the university, and different associations. Notably, he was one-time public relations officer of Lilu Development Union. He was assistant secretary of Recreation Club Olu. He was secretary of the Nigerian Medical Association Olu Zone. He was vice chairman of NMA Olu Zone. He was secretary NMA Enugu State. He was chairman NMA Enugu State, and was also chairman NMA National Committee on Continuing Medical Education and Standards, among other posts. He was appointed Associate Dean, Faculty of Medical Sciences, Clinical, from 2014 to 2016, under his right-hand man, Professor Uchenwaga, and eventually elected as the Dean of the Faculty in the year 2020, again taking over from his classmate and friend, Professor Sebastian Ekenze. Currently, he's the Deputy Provost of the College of Medicine, again, working under his friend and classmate, Professor Hyginus Ezegui. Can see there are too many classmates of these 1990 class people. He belongs to so many professional bodies, like the British Thoracic Society, the American College of Physicians, African Thoracic Society, and Nigerian Thoracic Society. His research interests are in management and care of asthma, chronic obstructive pulmonary disease, and lung infections. He also has a passion for HIV medicine, with special research emphasis on respiratory diseases in people living with HIV. He serves as an examiner, both undergraduate and postgraduate examinations, and also a facilitator of the National HIV Treatment Program workshops and update courses. He was a member of the technical working group that at one time offered the national guidelines on HIV management, the facilitators manual for training medical doctors in HIV medicine, and participants manual for training doctors in HIV medicine. He was appointed a member of the Health Ministerial Experts Advisory Committee on COVID for the health sector response by the Federal Ministry of Health in the year 2020. He's a certified trainer of trainers, an astute physician, a researcher with well over 60 publications in peer-reviewed international and local journals. Above all, he's also my friend. Family life. Cajetan got married in 1996 to beautiful Princess Chidi Elanda, a princess from the Akata royal family, and the marriage is blessed with 3 children. The darling wife Chidi is a graduate of the University of Uyo, where she studies sociology and anthropology and works at the NMPC mega station here in Enugu as the account supervisor. Adobe, the first daughter, is a graduate of English and Theatre Arts from the University of Nigeria and currently works with Intelligent Innovations Limited Lagos as a partnership manager while pursuing her master's degree program in media marketing communications at the Pan-Atlantic University of Lagos. Obinna, the second child, a male, is a medical doctor, one of our graduates. He's currently doing his youth service here in Enugu, even though I know he has some other plans. While Ogonna, the third child and last, is a 4th-year medical student here with us at the University of Nigeria Medical School. Dooms has a traditional title, but he refused to tell us his traditional title in the village in Lilo, but I may have to mention it. However, Dooms, as is popularly addressed by friends and peers, enjoys playing tennis, political analysis, and also enjoys watching the game of the round letter objects. Ladies and gentlemen, can you just join me in ushering in our guest lecturer for the day, the 181st inaugural lecturer of the University of Nigeria, Professor Cajetan Chigozie Onyedun.
Vice Chancellor of the great university, University of Nigeria, my alma mater. I'm so proud of it. I want to stand on the existing protocol so we can get to business. I equally want to thank my dean and my friend for the kind words in that citation. I have tinkered about this inaugural lecture for years, and finally here I am. I'm happy to be here. And the topic is something I think and thought over and over again, and say cough. You know, over my years as a pulmonologist, when patients come to the clinic, you are reviewing them, you ask them, are you coughing? Just like my Vice Chancellor said, I say, we are going to find out in the next few minutes whether or not. So the topic, like I said, doctor, I have normal cough. Is it really normal? I doubt if it's normal. I feel privileged and honored to be here. And like I said, today is the academic coronation. Otherwise, say it that way, the academic ofala of Dr. Cajetan Chigozie Onyedun, Professor of Pulmonology and Medicine. It also showcases what I have done to be here and has allowed me to tell my story the way it is. I'm sure you listen to that. I feel I should tell that raw story because it's not easy for me to be here. Some years, about 20 years ago, I never imagined that one day I will be giving this inaugural lecture. But here I am. Can only be through God. We don't always notice when we cough. We don't. In a day, over 24 hours, most of us would have coughed about 30-something times. We don't even notice. Because it's the body's way of clearing the air passages. I will try to talk science and then talk in a way most people here will understand so that they will go out with something. Having said that, some of us in this hall must be coughing, but they are trying hard to suppress it. At least let the event finish so they can go out and cough. Some elders are known to clear their airways before they make important speeches. I'm sure if we think back, we remember one of our past presidents who used to do that a lot. If you call the name, now you talk more. We also know that throats are cleared to alert or redirect somebody to talk who is talking out of order. The person will just get himself back. In the same way, if you're in your house and see a security breach, maybe somebody jumping through the window, and you don't think you can confront that person immediately, you could just cough. And that might make the person know that somebody is in that house for that day and be on the run. Cough is a very common symptom. It accounts for up to 40% of clinical practice activities. Because it causes across not only respiratory, those who have cardiac disease also cough. Those who have respiratory disease also cough. So, you can imagine. A little bit of science. It is primarily a reflex action. Just like blinking your eyes. Just like sneezing. And what does the body do with it? It helps to clear the passages of what? Foreign matter, pathogens, and what could have been harmful, thereby protecting the airways. Is nature not wonderful? But sometimes, like I said, it can be voluntary or involuntary. At times, this cough can do what? Cause problems. It is often sudden, forceful, and comes with a sound. Sometimes that sound could be a pointer or a giveaway to the disease in question. Like, I'll give an example, the whooping cough. Once we say whooping cough, everybody here knows it. It's just because of the characteristic sound that it gives when you cough. More often, people coughing, the cough will clear on its own. And I hope not. The cough is not suffocating anybody here. So, but when it's sustained, it becomes a distressing symptom and can be very troublesome. Unexplained coughing always indicate an underlying condition. And if that is the case, please see your doctor. I've said this is an important defensive and protective reflex. It can become troublesome. And what does it do? Erode the mucosa and cause potentially harmful. The diagram there just shows us the respiratory system. And the cough receptors, so to speak, are found in the epithelium of the respiratory system, the diaphragm, the esophagus, the stomach. So what it means that things happening around the stomach, the esophagus, can cause cough. The cough reflex arc is made up of three main pathways. The scientists here will know. We have the afferent, they have the central pathway, and we have, they want to cough. Please cough well. And the motor efferent. It's okay. DJ, they have had you. So it's a reflex arc. And for the scientists, that means there has to be the afferent, there has to be a central way, and there has to be what? The motor pathway. The arc starts from irritation of the cough receptors, which can be chemical or mechanical receptors. The chemical receptors respond to acid, cold, heat, while the mechanical receptors respond to touch and displacement. It's the receptors that will now send sensory information through the afferent nerves to the central body where it is controlled. And then the central system will send back information to the muscles of the respiratory tract causing the cough. There are three types of sensory nerves: the rapid, the slow, and the C fibers. The motor center is at the nucleus tractus solitarius in the medulla oblongata. I'm sure that people they like hearing this, medulla oblongata. Everything ends there. And the major nerve, both efferent and afferent, is the vagus nerve. So the respiratory muscles that contract include the diaphragm, the laryngeal muscles, the external intercostal muscles, the rectus abdominis, and internal intercostal. Of course, when the diaphragm contracts, what happens? The thoracic cavity gains more size. And when the laryngeal muscles contract, it closes the vocal cords. Because the cords need to be closed for that action to initiate, so that you now try to aspire against closed glottis. And that is how the cough comes about. That's the science about it. So the phases of cough reflex include the inspiratory phase, the first one. Due to the irritation, the vocal cords open up. This allows more air to enter the lungs. Then comes the compression phase. The epiglottis cords close, trapping the air within the lungs. And there is a kind of expiration against this closed glottis, leading to increased pressure, and then the vocal cords open again, allowing the air to now escape against some force leading to the cough. The pressures that build up during each cough can be up to 300 millimeter mercury. Just imagine the blood pressure that we measure and we say when it's above 200, it is so high, that kind of a thing. So you need the intrathoracic pressure can be up to what? 300 millimeter. And the velocity of expiration can be up to 800 kilometers per hour. So that's how cough could lead to damages in the lungs. And that is how cough could lead to aerosolization of particles, which is one way of transmitting diseases. So, the pressures are necessary for clearance are equaling the cause of most of the complications, which include insomnia, headache, dizziness, musculoskeletal pain, hernias, urinary incontinence. Cough-induced risk fractures can occur, which occurs mainly in women, involving multiple ribs between 5 and 6. And it's said that because women have low bone density, that's why they have more fractures. So, coming to the complication of cough, it's a social burden. It causes psychosocial effect and leads to embarrassment. If you are coughing here now, it's very embarrassing. Not many people will come near you. Everybody will want to sit. Once you know somebody is coughing there, you want to change your seat. So, it equally leads to negative impact on the well-being of any person. It's equally associated with impairment in daily activities. And again, when you are coughing, you could now consume a lot of cough syrups and antibiotics, resulting in side effects, which include drowsiness, drug abuse, and sometimes intoxication. When we get to cough syrups, you see, sometime in the past, they were banned because of contaminants. Not everybody cough. And people who don't cough do have recurrent infection, atelectasis, and a lot of airway disease. And they include people who are old, the newborn, people who have undergone transplant, and then patients with rib fractures, patients with tracheostomies. Yeah. Okay. Fine. So, because they don't cough, they don't clear their airways, that leads to recurrent infections. How do we classify cough? It can be acute. If it lasts less than 3 weeks, it can be subacute. If it lasts between 3 to 8 weeks, it can be chronic, lasting for more than 8 weeks. For children, cough lasting for more than 4 weeks is regarded as chronic. It can equally be classified based on whether it is productive or not. There's dry cough, there's productive cough. Dry coughs usually associated with common cold, catarrh, and what have you. And then, but most dry coughs will clear on their own. Then you have wet cough, where the body produces mucus. This can occur in asthma and in COPD. Always spit out the mucus. Always spit it out, if possible, because swallowing it could cause stomach discomfort, vomiting, or even more infection. So like our Igbo people say, that means do not swallow sputum because of the shame of spitting it out in the public space. Always, and that's why we find respiratory coughs with people who cough a lot. Chronic cough is occurs in about 10% of the population at any point in time. People with chronic cough, about 10 out of 100. In a Nigerian study, we found chronic cough of up to 3.8%, but this was a hospital-based study. It occurs more commonly in middle-aged women because of their increased sensitivity to the cough reflex. Cough frequency is much lower at night than during the day. However, illnesses like asthma, heart disease can cause more cough at night. Cough that brings patients to hospital in 10 to 40% of cases may not be able to be explained easily. And that is the mystery sometimes. Even when you have done all the investigations, you find out that you don't even know why they are coughing. But that concept is being decoded now to be what we call cough hypersensitivity syndrome. It defies normal treatment. At times, like I said, people clear their throats. That is not an illness because the food has passed the wrong way somehow. Or like what I explained before, trying to allow somebody to talk more properly or what have you. Acute cough could be due to environmental irritants such as smoking, smoke, dust, fumes, or allergens. However, it can equally occur in lower respiratory tract infections like pneumonia. So what I will do from now is to concentrate on the common causes of cough in our environment and try to talk the emphasis where it should be and how in our research work we try to uncover some of the challenges. So it's more of the symptomatology and the challenges we have while managing such patients. The first on the list is pneumonia. The one people come to the hospital and say, Doctor, oyi baramaho. You know, our people just believe the ones they have pain anyway, they say oyi baramaho. It's actually an acute inflammatory process of the lungs due to an infectious agent, which can be bacteria, which can be viral, even parasitic or fungal. Classification of pneumonia can be due to etiology or the pattern of lung affectation or the setting which is acquired. Community-acquired pneumonia is a major cause of morbidity and mortality in our environment, and this is common than other forms of pneumonia. The symptoms include that of fever, breathlessness, chest pain. In a study in 2011 by Onyedun and Chukwuka, cough was the predominant symptom in about 71% of patients that we studied. In same study, community-acquired pneumonia accounted for up to 2.5% of all medical admissions in the UNTH. And mortality was comparable to what we have all over the world, about 11%. So it means that if you have pneumonia, in 10 out of 100, you are likely to die, especially when it is severe. In another study, we found that pneumonia is mostly caused by bacteria in adults. Studying 202 patients, 189 out of them had bacteria isolated. And comorbidities such as HIV infection and diabetes impact negatively on the course of the illness, making them to die more, increasing their length of stay in the hospital, therefore increasing the cost of treating that illness. And that was a study by 181st Onyedun 2015. Diagnosis of pneumonia is often made on clinical grounds, empirically, and you must have to start antibiotics. Luckily, chest X-ray is something you can lay your hands on, and it can actually come out within a few minutes if settings are right. Of course, for you to treat pneumonia very well, you need to assess the severity. And in our study, we found that the COP65 scoring, which is a clinical scoring, was able to predict mortality and other outcome measures, including length of stay, in patients who have community-acquired pneumonia. Treatment is use of appropriate antibiotics, supportive measures, including the scoring for severity. Our study, which we did, showed that the patients are poorly assessed and inappropriate antibiotics were given, even in tertiary institutions. And this is a call for concern. You find people writing all sorts of antibiotics for people with community-acquired pneumonia. Actually, with proper treatment, symptoms of pneumonia, such as fever, will actually clear within 48 hours. And the symptom of cough should clear within 1 week. If you are looking at the X-ray features, it could stay there for the next 1 month. So don't just continue to do X-ray and say the patient has not recovered. Treat the patient. That is the message. This is just an X-ray of somebody with pneumonia, with consolidation, the kind of picture we have. Now we go to the chronic causes. Upper airway cough syndrome is the commonest cause of chronic cough, also called post-nasal drip, in which instance you see secretions from the sinuses draining down the throat, causing cough. It includes conditions like allergic rhinitis, chronic rhinosinusitis, and deviated nasal septum. What do these patients do? They come in with cough, rhinorrhea, which is catarrh, nasal stuffiness, and they keep clearing their throat often and sneeze often. It is commoner in women, like most diseases, though women survive diseases better. That is the truth. They have the disease, but they survive better. And maybe because of their awareness, they are the best to be in the hospital before the men. Is that not true? Physical findings include swollen turbinates and even direct visualization of the posterior postnasal drainage. Treatment, use of first generation antihistamines is both diagnostic and therapeutic. In every cough, try to use humidifier, steam inhalation, keeping hydrated, sleeping on propped up pillows, nasal irrigations are useful. The next is asthma, ụkwara ume-ọkụ. One of the illnesses, when you make the diagnosis, somebody will say, it's not my portion. They don't want to have that, and who will have it? In Nigeria, the prevalence of asthma, they put estimate up to 10% by a study by Musa et al. Asthma is estimated to occur in about 30 million Nigerians, and worldwide up to 334 million people have asthma. Prevalence of asthma ranges from 24. Prevalence of asthma in patients with chronic cough ranges up to 29%. The important symptoms of asthma include intermittent symptoms of cough, shortness of breath, wheezing, chest tightness, allergic symptoms. Wheezing is that one they say, my breathing is very noisy, sounds like a pusscat. Cough may be the only manifestation of asthma, what we call cough variant asthma. So when people cough and you can't identify the cause, check whether they have asthma too. It poses a lot of substantial physical, socioeconomic, and mental impacts on our patients. A frequent cause of poor sleep, limitation of activities, absenteeism from work, and reduced savings and indebtedness. This is in a study we did here in 2019, because the drugs are expensive. Asthma leads to heavy financial burden on the patients. When we did a study on out-of-pocket expenses, the physical impacts could be found in up to 59% of the patients, the economic impact in 51% of the patients, and the social impact in up to 47% of the patients. The mean annual direct cost of asthma is up to $368 per year. On the average, about $30 in a month. That is substantial, most of them coming from drugs. In a systemic review we did here, 2013, we found that management is faced with challenges of diagnosis, treatment, and follow-up. Also, challenges of poverty, inadequate resources, weak health system, and poor infrastructure. And there were a lot of variations in the diagnostic criteria, and this leads to under or diagnosis. There is equally lack of national hospital protocol on guidelines for treating asthma. And this was what we discovered in our own study. Another big challenge includes poor technique on usage of medical devices, especially the inhalational drugs. Patients do not know how to use it. And we found that up to 80% of patients were not able to complete the necessary steps for those using the common Ventolin inhaler. And up to 60% were not able to use their dry powder inhalers, like we find in the Seretide and what have you, very well. And in all this, we find that patients with higher educational qualifications, less frequent asthma symptoms, and those that have been taught by a doctor in the past are more likely to use their inhalational devices better. And what did we conclude? We said that there must be routine assessment of their inhaler technique at every visit and to be corrected if found to be abnormal. So it's not like somebody comes and says, I use it well. They are encouraged to come with their medications always, and it has to be checked and rechecked. Asthma is not an infectious disease, and patients should never be stigmatized because they have asthma. Some notable world figures have asthma, which include Bill Clinton, Jeff Kennedy, Gabriel Sellers, Frank Lampard, Dennis Rodman, Mike. All these people are great sportsmen. They had asthma. It never limited their activities. So being asthmatic should not limit your activities. I will just go through this. Chronic obstructive airway disease, a preventable and treatable airway disease, characterized by airflow limitation that is not fully reversible, and is always a progressive illness caused by abnormal response of the lungs to noxious stimuli, which cigarette smoking is the major culprit. I'm sure the smokers here will not be happy to hear this, but that is just the fact. At any point in time, we say, stop smoking. So I'm saying it now, stop what? Smoking. And apart from smoking, other exposures, occupational, pollution, hereditary, and previous lung infection can equally cause COPD. Two pathological entities are found in this illness, and they include emphysema and chronic bronchitis. In all this, COPD is associated with what? Systemic consequences, including weight loss. So, what do we have with COPD? We have frequent infections, cough, and disability. Management of COPD follows Global Initiative for Chronic Obstructive Lung Disease, the gold stipulated guidelines. Spirometry is diagnostic. In our study, we found that understanding of these guidelines was satisfactory among Nigerian doctors, but however, there is poor adherence to the guidelines. So we posit that educational interventions are needed to improve the implementation of guideline-based management of COPD. Treatment, of course, include bronchodilators, steroids use, antibiotics and oxygen, smoking cessation, and exercises, as the case may be. One of the big ones, tuberculosis, Okwaranta. I'm sure everybody is one of the reasons why we don't have residents in internal medicine. Once they come around and ask you, are they going to be treating TB? You said yes. They will say, let them go and consider again. Of course, some of us have been in the business over years. We didn't have TB. But then, even those who didn't come to chest clinic had got TB. It's a disease that is very common. Even if you're in the higher class, you can have TB. It's a potentially serious lung disease, an infectious disease for that matter. Bacteria is spread from person to person through tiny droplets released into the air. Symptoms include coughing for more than 3 weeks, coughing up blood or mucus, chest pain while breathing on coughing, unintentional weight loss, fatigue, fever, night sweats. So the symptoms are wide, and it can actually affect every organ in the body, not only the lungs. People with TB can cough for up to 327 times in a 24-hour period. Remember, I said the normal is about 30-something. So in this instance, they could cough repeatedly, and that could be very terrible for them. TB is Nigeria is ranked 6th nation with highest number of TB cases globally. 6th. You can see we are number 6. And by 2021, we are number 1 in Africa. That's our rating. we contribute 4.4% of the global burden of TB. This is the kind of things we have to rate high. HIV and other chronic debilitating illnesses like diabetes and cancer had led to a new wave of increased TB prevalence. It remains a major killer disease. However, we are battling now with drug-resistant trends, and it's becoming a big drawback to treatment. In our study of prevalence of drug-resistant TB in Nigeria, we found that the prevalence rate of any resistance in new TB cases up to 32%, among previously treated cases 53%. That's quite high. And the multi-drug resistant type, which is resistance to at least the two most important drugs used for TB, INH and rifampicin, you found that in 6% of new cases and up to 32% in previously treated. That is a challenge for all of us. So drug-resistant TB burden in Nigeria is very high, and further studies are recommended. Drug-resistant tuberculosis is a serious public health challenge and potentially a bioterrorism too. If somebody enters this room now and says, I have drug-resistant TB, I'm sure half of us will scramble through, or in a flight, for example, going on, somebody announces, I have drug-resistant tuberculosis. The pilot may have to take the next available airport to land. And it's one of those diseases too, where people say, it's not my passion, not my portion. And what happens in TB? People don't really agree that they have TB. So that makes them to go through a lot of routes. You could see somebody who will have TB in Imo State. He will travel from Imo State to Benue State looking for cure. Eventually, we end up in FMC, Makode. You can imagine how many hospitals the person has passed by getting to Benue just to treat tuberculosis. We did a study where we tried to look at the programmatic issues in TB in Nigeria, and we advocated that for you to improve case notification, reduce morbidity, prevent development and spread of drug-resistant tuberculosis, there is need for improved monitoring, supervision, home visits, better reporting systems, and dot expansions in states yet to achieve the target treatment success rate, which is still very poor, just about 45% achieved out of what is expected to be more than 70%. So despite the free treatment for TB, healthcare costs incurred prior to appropriate patient-provider transaction is high. So like I said, people don't just consult easily. Even when the treatment site is just by the corner there, they travel far. And before they get there, they have spent their money. And eventually the treatment is what? Is free. But they'll spend their money trying to look for cure. I'll just show you an X-ray. A lung that has large cavity, and then that is TB for you. And even after good treatment, in quotes, because of the way and manner they present late, some patients will still come down with destroyed lung, and that is a challenge we are beginning to have now. A lot of destroyed lung. This lung here now, one lung is gone. What you have is just half that is emphysematous. This patient will come down with symptoms, and he will report that he has completed therapy, and that is a big challenge. That's the work my resident is doing now. He's capturing a lot of people who are gone from treatment sites, claim to be well, but their X-rays is showing us something else. So it's something that we may have to intervene and say, do we continue to treat for TB for 6 months? Do we extend it? Is it time we review even the drugs we are using? Is it really doing it? So these are the challenges. Lung cancer is the other one, big one. It will cause a lot of cough. It can be primary, it can be metastatic. Most cases, they do not cause symptoms until they have spread. Some people with early lung cancer do not even have symptoms. But if you go to your doctor early, they could determine whether you have any challenge. The common symptoms of lung cancers include cough that does not go away or get worse, coughing up of blood, chest pain that is constant or pleuritic, which means it's worse with breathing or coughing, change of voice, hoarseness, loss of appetite, shortness of breath, feeling tired or weakness, recurrent lung infections that don't go away or keep coming back. One president before in South Africa kept going to the hospital often and on until he died. That is the kind of symptom that lung cancers come with. If you have any of these symptoms, it is important that you see a doctor immediately. Immediately. If lung cancer spreads, it can cause bone pain, nervous system disorders, including headaches, dizziness, illness of the eyes if the liver is affected, swelling of lymph nodes. A chest X-ray is always the first investigation to carry out. Of course, if the facilities permit and the infrastructure permit, CT scan. Other investigations, high-tech as it may be around here, but not as much like that over there, MRI, positron emission tomography. But then we can do thoracic synthesis, needle biopsy, and the treatment of lung cancer depends on the cancer and the staging of the malignancy. That is it. So if you have all these symptoms and it's not going away, please report. Just showing you a lung that is masses, both sides. This is kind of picture you see in bronchogenic CA. Of course, the patient should go to the hospital. Another important part of what we are talking here is drug-induced cough. And most antihypertensives, most people with high blood pressure, hypertension should know this. Often when you start your medication, you start coughing. And many times you start going to hospital, you are being investigated. Meanwhile, it's one of the drugs that's causing it. So we have the angiotensin converting enzyme inhibitors, captopril, lisinopril, lamivudine. This happens in about 15% of the cases. It occurs within 1 week to 6 months of onset of therapy. Luckily, this kind of cough will resolve once you stop the medications and the other medications that you can switch over to, including the receptor blockers. Then the cough hypersensitivity syndrome, the chronic refractory cough, like I said before. Even when you have done everything trying to investigate these patients, you find out that they have still have cough. And most patients, it happens in up to 40% of patients presented to the specialist clinic. The pathophysiology is complex, includes cough reflex rhinal hypersensitivity. And that means that little things that will not cause cough often will lead to cough. And it's a challenge. And that is where research emphasis is going on. Because the treatment is not just giving anti-cough syrups and antibiotics. You may need to use neuromodulators in this kind of patients, like gabapentin. Then the smoker's cough, chronic cough or tobacco use. And I have to say here, most smokers deny their cough. They will tell you they are not coughing, that they know what is happening. They don't present. Even when the thing has changed from COPD, changed to lung cancer, because these are risk factors. The smoking is risk factor for all this. They will still justify it and say that they know why they are coughing. The burden of smoking is quite high. 1 out of 10 Nigerians still smoke. And we did a study of to find out the level of secondhand smoking in the environment. We found out that up to 38% of people we interviewed, about 1,000 people or so, had secondary exposure to people smoking, and especially in public places. I'm happy that this is coming down because new regulations, you no longer see a lot of people smoking in closed chambers, but you still see them in outdoor places. But if your spouse is smoking, of course, the house is full of smoke, and you must have to do something. I'm sure some people are laughing over there because they know that I know where the thing is coming from. So, smokers, like I said, often justify their cough. And another thing is that when people quit smoking, because smoking on its own suppresses cough reflex, they are bound to have increased smoking. So at times, it discourages them. So you better warn them ahead of time that this stoppage might lead to increased cough. Then eventually it will stop. So that is one of the things you must, so there's often a transient increase in the cough within the first month of stopping smoking. But that is not a problem. Gastroesophageal reflux disease, this is where we and the GIT specialists come into play. I mean, we work together here. But the important thing is that most patients with reflux do not have cough. Some of them improve with use of antacids. Some do not even respond to proton pump inhibitor. So it's still neither here nor there. But that exists because it is due to aspiration of gastric contents because of the reflux into the lungs, causing this. You have OSA, the so-called obstructive sleep apnea. We know these people who snore a lot while sleeping, they have chronic sleep apnea. 30% of patients with OSA complain of chronic cough. Of course, it becomes necessary to evaluate for OSA in any patient who has chronic cough. And treatment of OSA with continuous positive airway pressure ventilation often improve the cough. The suppurative lung diseases, they are disappearing but appearing once more again because of improperly treated lung infections and what have you. What do you have there? You have people with chronic cough that is coughing and sputum, purulent, pus. They have bad breath. They have mouth odor. The sputum production is alarming and often affected by position. So they tell you when they lie on this side, they produce a lot of mucus, they produce a lot of sputum. And at times, they can cough up blood, pure blood. Diagnosis is confirmed by imaging study like CT scan. And treatment is persistent use of antibiotics, bronchodilators, chest physiotherapy, hydration, nutrition therapy. And the next slide, you see typical what you see, air fluid level in somebody who has a lung abscess. So air fluid level is not just for pleural effusion. Always think, especially when you see it and it's not looking as big, look beyond that. There might be an abscess cavity. Just to mention cardiovascular disease, like I said earlier, cough is a cardinal symptom of heart failure. And it caused because of pulmonary edema. The cough is worse at night. Sputum can be copious, frothy, foamy. Sputum is foamy. And patients with heart disease are now known to be at risk of myocardial infarction. People who have chronic cough are at risk of myocardial infarction. This was an outcome of analysis of the Framingham Heart Study data, which identified that both chronic and non-productive chronic cough are risk factors for myocardial infarction. Cough in other diseases. It has been found in patients with sickle cell, stable patients. The study by 181st INAUGURAL found that up to 36% of people who are stable had a chronic cough. The same thing with patients with HIV. And cough is one of the cardinal symptoms of what we just passed through, COVID-19. So if you have cough, no matter how mild, and in that era, you'll be tested for chronic cough. In Sweden, I won't delve into pediatrics here. I won't delve into pediatrics for obvious reasons. My chiefs are in front of here. They're in front, trying to hear what I will say. But just know that chronic cough can happen in pediatrics patients. Of course, you have the protracted chronic bronchitis and the upper airway chronic cough syndrome. Chest radiography, spirometry should be considered initially in age-appropriate patients. The pertussis cough is classical. The whoop sound, you can't miss it. And so how do we assess cough? We have 10 minutes to go. I'm timing myself. Okay. Please seek medical attention if you have all this. If you are coughing up thick sputum, experiencing shortness of breath, experiencing fainting, and emergency care must be sought for if you have choking, vomiting, having difficulty with breathing. Initial evaluation should include spirometry, chest radiography. Unfortunately, knowledge and practice of spirometry remain poor amongst Nigerian doctors because of unavailability of spirometers. This is improving now. This study was 2009. Bronchial asthma is the commonest indication for use of spirometry in our environment. When physical examination findings are normal and no red flags are present, computerized tomography of the chest and sinuses may not be necessary, or even initial bronchoscopy. That is the respiratory machine. And treatment of cough, it should be directed to the cause of the cough. Sometimes coughs are severe enough to make breathing difficult, cause vomiting, or cause following thoracic abdominal surgery, please, in this instance, you may have to suppress the cough. Drink a lot of fluids. Dry hacking coughs may respond to honey in hot water or lemon juice. Try a cough drop to soothe the airway. Quit smoking with immediate effect. Again, I said it again. Quit what? Smoking. You can't be coughing and be smoking. It's not allowed. Avoid exposure to inhaled irritants such as smoke, dust. Massage, because of the muscle pain, could help. For chronic refractory cough, like I said before, you may have to do sequential therapeutic trials. You may have to use neuromodulators. Use of cough syrup. No evidence to determine whether the cough syrups are working. They are often abused. Some of them contain old generation antihistamine, causing drowsiness, and must be avoided if you must drive or operate machines. Avoid cold remedies that combine all medicines. You know those ones, pro-code, pro-this, everything is there. Avoid them. There are two kinds of cough syrups. One is expectorant, one is suppressant. Suppressants may suppress the cough, but shy away from that. Sometime in the past, our regulators had to ban, that was 27th of April this year, had to ban one of the cough syrups for causing kidney damage. Research gaps, like I said, the chronic hypersensitivity stuff is coming up, and little is known about natural history of chronic cough, and then patient-reported outcomes. There are few studies on cough in our environment, so a lot of them need to be done. In conclusion, cough is a natural body response similar to other reflexes. Occasional cough may be normal, but a cough that persists is not and cannot be normal. Coughing can occur due to primary respiratory illness or as a complication of other disease. A new entity described as refractory cough, hypersensitivity syndrome, is emerging as an entity of its own. The burden of cough is both as for a symptom as a consequent disease, and is negatively impacting on the well-being of people. Any cough lasting for a few days, especially with red flags, must be investigated very early. Awareness of cough varies considerably. It may be distressing when it appears suddenly or appears in paroxysms, especially associated with discomfort due to chest pain. Cough that develops over decades in a smoker, for example, or other chronic ear abnormalities like asthma, may not be noticeable and thought to be normal by the patients. To a large extent, do not suppress the cough reflex. If you have persistent cough, you should see a doctor. Use of routine cough syrups should be avoided. And I will end by asking my listener, do you have a normal cough? Is that your cough normal? Please see a medical doctor. Ukwara na akwa enwe na akwa osisi na n'enu. You people say it. Anaghị eji na agụụ na agụ no ukwara. Acknowledgements. I must thank God for today, for being able to keep me fit to be here and do this job. Let me also thank the Vice Chancellor, he has left, who graciously approved for this to be done today and appeared there in person despite his very busy schedule. I equally want to thank the senior ceremonial chairman, Professor Bennett Chima Wanguma, for his guidance, a friendly man indeed, a gentleman. Please clap for him. To my beloved parents, late Simon Onyedun and Georgiana Onyedun, I thank you so much for all you did for me. It pains and hurts that they're not here today. So painful. And to my late sister Chechuku, she was with me all this while. Her demise cost a lot on me. To my beautiful and lovely wife, Chidi, the princess from Akata Kingdom. Is she there? I can only say thank you so much for keeping the home front so comfortable and beautiful. Most of you will not know my strength when I do all the things I do, all the politics. It's just because I know that in the house there's no politics. We say it the way it is. I'm sure you remember our gentle beginning. And that thing we wrote on our card that says, we met by chance, we married by choice, and we asked God to do what? To keep us together. And the everlasting love. And looking back, this 28 years ago, I believe we can thank God over and over again for granting our prayers. You know I love you. Yeah. To my beautiful children, Adobe, what do you stand up? I mean, Obinna, he just escaped. I know he will escape. I saw him leave. Ogonna, thank you all for growing up very obedient and humble. It's been worth it. To my brothers and sisters, Paul, my elder brother, my confidant, I go wave now. Yeah. Chidebere. Chizoba. Ifoma. Chinyere. Sorry. Her. Where is she? Somebody's covering her. I know. Yeah. Thank you all for all the love and we've always been united as a family. And they are just the best and my strength. To my cousins, Jude, Tunji Braithwaite, Ferdinand, Ono Concord, I can see to Beya Sobi, Taito, Sunday Uchebuna. I can see Apollonia Onyedun. I saw her in the screen. I didn't know she found her way here. I'm happy you are here. Thank you very much. To my maternal uncles, they are not here, but I know they are here in spirit. Anthony Onaka, the son is here. Raphael. Oh, didn't know much. I didn't know if we were in this crowd. You see, I can't even see anyone. And to my godfather, Dennis Onaka, he took me as his son early in life, guided me, and it was going through his lesson notes. He's a teacher, a retired principal, that made me like science subjects. I had to copy his notes even when I was in junior class, kept them, and when it was my time, I now use those notes and became a champion. So I thank him so much for that. To my cousin, sponsor of our wedding, the MC in our wedding, Chief Adolphus Dumwere, and the lovely wife Uchenna, who is not here, she's in UK. Are you not here? I thank you so much. This is my cousin and the wife were instrumental to my marrying my wife, and they kept being with us till today. May God continue to bless you. My mother-in-law, Lord Lugeze Roslyn Oloha, such an amazing woman. She's not here. But to my in-laws, from Akatali, Lumunz, Mbise, all of you are wonderful. I can cite Prince Henry Omuchekwa Oloha. That is my wife's younger brother. He looks like he's the elder one, but I could cite Udoka Oloha. I will call their names. I don't know. Where is she? She not? Yes, my in-law. Juliet. I don't know those in the crowd. Please forgive me. You find your car for Okoyebago. Please forgive me. Prince Peter Oluwan. I don't know those who are in the crowd. One of my wives, Ngozi Chizoba, I could see her. Yes, that's what I call her, Ngozi Chizoba. That's the wife of my younger one. To my chiefs and trainers, starting from Professor Shimo Chukwuka, my boss and supervisor. Unfortunately, she's traveled out of the country. A woman of good mind and heart, with good disposition. She literally took me as the son and younger brother and carried me along. And that is why I'm here today. I thank her so much. To Professor Ifeoma Olasi, I will say this for the first time. I remember how she dissected my first attempt to write a proposal into achievable and unachievable objectives. And that was indeed a turning point in my writing skills. What is it? I thank you so much. Professor C.K. John, my boss, Professor Sam Ike, Professor Moke Dukos, Professor BJC Onwubere, Benedict Anisoba, Gladys Ozo, Eyumba. These are my people. They stood by me and they were there anytime I called them. And I can say it and I mean it. This is what it has always been. Your immense contributions towards my ascending to the pinnacle of learning and excellence are legendary. You all participated a lot in grooming the man that is here today. To let Z Shukujama, he facilitated my appointment to conduct in UNTH. Thanks for standing by me at a crucial point in time when some people were bent on throwing me out of the system. May your soul come to rest in peace. And the wife must be here. Please stand up for recognition. Please. Our former DA, you're welcome. I'm lawyer. To let Professor Aloy Agaji, he single-handedly facilitated my appointment to this great university. I'm happy that I didn't disappoint him. May his gentle soul touch to rest in peace. To my mentors and guardians, Emeritus Professor N.S. Onwasigwe, the boss of all the bosses, a man with uncommon generosity. I'm lawyers. To my mentors, I will list them. Professor M.S.C. Agaji, I like medicine the moment he started teaching us. And when I served under him as a house officer, in fact, I became a surgeon in my head. And that was what Ejim was trying to describe. Thank you so much. Professor V. Oike, Dr. A.C. Nwabese, Emeritus Professor B. Dibe, Emeritus Professor John Oli, Professor I.U. Obi Nweregolilu, incidentally, he is the chairman of my wedding, and he is here today. That was 8 years ago. The first professor from Lilu Town and the 15th inaugural lecturer of this great university. Emeritus Professor Rich Ume, Emeritus Professor Nene Obianyo, His Royal Highness Peter Ebibo, and the rest. You are all wonderful. And to my contemporaries and allies in Department of Medicine, I don't know where to start. Professor Uchi Ijoma, Professor Emmanuel Lejim, the Dean, Ekwelu Ngene, Professor Obinoro, my own man, Professor Christian Okafo. There are so many down screen. Please, you are all recognized. My co-authors, Dezalu Kinsley Okwaja is here, and my boy is here, a promising young man. And to my people, Dr. Hilary Odiniye, Dr. Paul Nlewedim, Kinsley Okwaja, Victor Oduma, Chinayezan, all of them, Dr. Igwenyi, you are all wonderful people. To my classmates, my secondary school classmates, thanks for the competitive environment. Centrally, I can cite one of them here who have not seen since we left Abbott Boys in 1983. I saw him for the first time in this hall. Luke Ejezie, Apostle we call him. What was that he acted in Julius Caesar? Casca. Cassius. Yes, that was him. To my friends and classmates, I don't know where to start. Professor Uche Nawara, thanks for the push and pull. Dr. Chido Kode, Dr. Shio Ezudo, my brothers, Dr. Olumo here, Dr. Angone Alele, Dr. Sago, so many, I can't name them, they are here, they have been mentioned. Please, it's been wonderful working with you. To the medical students, you are my strength and you have become my ally. Where are the great size? Are they here? Continue to do good. To the staff at the ART, Department of Medicine, thanks for the love. To my great friends within and outside Nigeria, my friends from Enugu Sports Club, my friends from Recreation Club Olu, I can see them. They are just there. I don't know where to start. I can't mention, but I think I mentioned their names in the book. Thanks so much for being here today. I've been warned severally. I'm on the 1 hour mark. To my committee of friends, the LOC, ably piloted by my friend, Professor Cyril Dim, the chairman with precision and dynamism. Thanks so much. Please stand up for recognition. And to the other members of the committee, he did so well. But I must say, one good turn deserves another. I was equally the chairman of his own inaugural. To the members of the committee, Dr. Peter Kweme, Professor Uchi Doma, Ngozi Dim, Zukabiora, Chide, Nemo, Oshemo, so many of them, I listed them. Thank you so much. Thank you so much. And I thank everyone. I couldn't have done it without you. It's so
Thank you so very much. Please sit down. Please sit down, everyone. This cough business. You would agree with me that that was a fascinating, rather fascinating lecture, but I'm not the one to say that. May I invite the chairman, the deputy vice chancellor, University of Nigeria, Enugu campus, to first of all make his post-lecture comments, and thereafter make some presentations to the 181st inaugural lecturer on behalf of the University of Nigeria. The chairman, sir.
Thank you, Chairman of Senate Ceremonials. Let me stand on the already established protocols. Please, can we give a standing ovation to the inaugural lecturer? Can we stand and clap for him? Thank you, thank you, thank you. Sit down, please. I must commend him. Of course, I do not expect anything less from him. I know that Professor Onyedun is capable of holding us spellbound, and he did just that. And you find out that there is no way you wouldn't have learned something from this lecture, which was well delivered. So I want to thank Professor Onyedun for keeping us spellbound for the past 1 hour. And I'm not surprised that he exceeded his time, because I know one, just like his colleagues in the 1990s said, most of them are politicians. Most of them are politicians, and they've been here for quite a while, including the provost, the current provost, the immediate past provost. All of them are all politicians. So that's why he held us bound. And I want to thank the college community for giving him this wonderful solidarity. Almost every member of the college is here to witness, and you did not disappoint. You delivered the lecture very well. And your friends from the sports club, from the, not just sports club, I have seen some politicians here who are equally your friends, and your relatives from Lille and other places are here to grace this unique occasion. And I want to appreciate all of you for coming. And you find out that this lecture, what we have learned is that we have different types of cough. We have normal one, which you can use to clear your airways or use to correct somebody when the person is misfiring. You just clear your throat and the person is drawn back. We have so many other types and causes of cough. But the good thing we can take home is that all these coughs are all treatable. So all you need to do is make out time, see your doctor. If you have a cough that stays more than necessary. If it is not the normal one, please make out time to see your doctor. And I think the good news is that all of them, there is treatment for all the coughs. I remember during the COVID time, once somebody coughs around you, you now shift away from the person. But I don't think those things are now there. So, Professor Onyedun, thank you for a job well done. And he has shown us all the scientific research he has done concerning cough, and that's the hallmark of being a professor. That's why he was made a professor by the University of Nigeria. And he has not disappointed us, and we say that the sky is just your beginning. You will continue to do well. Now, on behalf of the University of Nigeria, we want to present to you, on behalf of the Vice Chancellor, who was here earlier but left, I want to present to you the certificate of presentation as the 181st inaugural lecturer of the university. There's also a plaque from the university to you. And we also have about 50 copies of your booklet that you can share among your friends and family members. So on behalf of the Vice Chancellor, I want to congratulate you and wish you well, and you continue to fly. Keep the flag flying. Thank you very much. So, ladies and gentlemen, I will hand over the microphone to the Chairman of Senate Ceremonials.
Thank you so very much. Thank you, Chairman. We'll take some announcements. The first and most pressing one is that the owner of the car is a Toyota Corolla, I understand, with registration number LND95GK is blocking someone's car, and the owner of that car needs to leave to attend to an emergency. So if that car belongs to you, please help us and move it so someone can leave. The PRO would make further recognitions. I understand that a number of prominent people entered while the lecture was on. Unfortunately, the lecturer didn't notice them. He was busy, of course. So, Choice, please do the recognitions, and I can shut down. Thank you.
Thank you, Chairman, sir. Ladies and gentlemen, can we please put our hands together for the Speaker, Enugu State House of Assembly, Honorable Edward Obosi. Sir, please give us a wave wherever you're seated. You're welcome, sir. We appreciate your presence. We're also having our midst Dr. I.K. Obi, Commissioner for Health, Enugu State. Give us a wave wherever you are. We appreciate your presence. You're welcome. Okay, once a commissioner, always a commissioner. You're welcome, sir. I know I saw earlier Emeritus Professor C.C. Nwosu, who has always been a constant to our inaugural lecture. Please appreciate him. I don't know where he's seated, but appreciate him. I know he's here. Oh, sorry. You're welcome, Prof. I would like to also recognize a former council member, Chief J.J. Ewuru. Please give us a wave wherever you are. You're welcome. Please put your hands together for them. Professor M.A.C. Alaji, past provost and past inaugural lecturer. Give us a wave, please, wherever you are. He's also accompanied by his wife, Professor Ada Alaji. You're welcome, ma'am. Honorable Chekwas Bazuago Oluoha. He's here too. Please give us a wave. Put your hands together for him. He's also here with his beautiful wife, Engineer Tina Oluoha Adoru. You're welcome, ma'am. Put your hands together for her. University of Nigeria Medical Student Association have a presentation for the inaugural lecturer. Leading this delegation is Right Honorable Ubani Royal. Please come forward.
On behalf of the University of Nigeria Medical Students Association, College of Medicine, University of Nigeria, Enugu campus, a congratulatory award presented to Professor Onyedun Chigozie Cajetan, Professor of Medicine and Pulmonology, Deputy Provost, College of Medicine, UNTH, Enugu State, immediate past Dean of the Faculty of Medical Sciences, a mentor and a father figure to all medical students in the University of Nigeria, on successful delivery of the 181st inaugural lecture of the University of Nigeria on this day, June 8, 2023. Congratulations, sir.
Oh, thank you. Quickly, before I hand the microphone over to the chairman for further announcements, I would like to recognize the National Secretary, Nigeria Medical Association, Dr. Cajetan Onyedun. Please put your hands together for him. You're very welcome, sir. Dr. Angeli Emecheta, Dr. Onyado Paul. Please put your hands together for them. And Dr. Is it Silvanos? I can't see that. Ezio, please recognize, appreciate them. I recognize you all.
Thank you, Joyce. Thank you very much. As you can imagine, we've come to the very end of this today's event, but not before these announcements. The first of them all is that the next inaugural lecture, the 182nd in the series, will be presented by Professor Zephyrinus Njoku. Professor Njoku is of our Faculty of Education, and so this lecture will hold at the Nsukka campus of the University of Nigeria. And his topic is abstractions and misconceptions, pedagogical approaches towards reducing students' learning difficulties in school chemistry. Professor Njoku is a professor of science education. That is scheduled for, madam, that's scheduled for in 2 weeks' time. No, it's scheduled for June the 22nd, yes, at the Princess Alexandra Auditorium, Unity Hall. And then the 181st inaugural lecturer has asked me to announce the different venues where guests will be served refreshment. From the look of things, this is not a light refreshment. And the chairman, I hope you're listening. The time has come for us to begin to tone down these refreshments, because it's so many lecturers are running scared of presenting their own inaugural lectures. And I'm going to say that the committee of friends to Professor Onyedun, you've done a brilliant job, but I'm going to give your number to the chairman of ICPC on campus to investigate you guys and know what you're doing here. And so, okay, the first venue for refreshment is the CIMAC conference room. And principal officers of the university, past inaugural lecturers, Igwes, priests, the Speaker of the House of Assembly, Enugu State, and all other distinguished guests will be served lunch at CIMAC conference room. The main hall, that's the main admin building, the hall attached to the building, admin building, is where all academic staff and other invited guests, including family and members from the Lilu community, the chairman and members of Enugu Sports Club, you'll be served lunch at the main hall. And the third venue is right here, the moot court, and this is where non-academic staff and all students will be served lunch. So yours is best, you sit back and lunch will be brought to you. Thank you for your attention. Another recognition of Sir Victor Atuamu, Chairman, Enugu Sports Club. Thanks for joining us. Vote of thanks. Well, I think the guest lecturer has done a brilliant job of thanking virtually everyone, some that couldn't even make it. And so mine would be to thank those that I owe bits and pieces of gratitude. And the first is the chairman, the vice chancellor, who bankrolled the business side of this lecture. The vice chancellor did not bankroll the refreshment, but he bankrolled the business side of things. And I'm particularly grateful on behalf of the committee for his continuing support. I'm also grateful to all members of the University Senate, members of the Governing Council of the University, former deans, former deputy vice chancellors, the provosts, and all past inaugural lecturers who found time to come. Your presence, as always, adds immense value to what we're doing here. And so thank you so very much for coming. Let me single out, as always, for recognition, Professor, Emeritus Professor C.C. Nwosu, who has, I think he holds the Guinness records for attending the most inaugurals. He does. Please, an applause for him. And he shocked me today because I had the privilege of riding with him from Suka to Enugu campus, and he told me that he attended his first Senate in 1970. Please give him an applause for that. And so we're also thankful to friends of the guest lecturer, his friends and his relations, his family, especially those that did the long journey from Lilu and Ihela to this place. Thank you so very much. I'm rushing so that this can end and so you can make the journey home, except he has made preparations for your accommodation. He's capable. Let me also thank my technical crew, the ICT team, the music department. They came all the way from Enugu to Art Color. The Kudimak people who are covering this for the Vice Chancellor's documentation. And my committee who also did a difficult journey from Suka to this place to make sure this went on okay. And then those robed academics, I always like it when I see the long procession here. And I make a joke that the way you guys greet each other, it seems as if you don't see often. So you thank me for bringing it together. And then I thank you for the colors that you bring to this place. And the chairman, it was an idea that occurred to me. Maybe we should make a special gown for past inaugural lecturers. What do you think? It's doable. We may have to think about, having a special gown for past inaugural lecturers so that people can begin to come together. Okay, my predecessor, Professor Fokansi, thinks it's a good idea. A council member thinks it's a good idea. Now we can make 3 boots, one for Moses and one for Jesus. So thank you so very much for coming. The chairman, with your permission, we can shut this down. Okay, let's say the closing prayers. Sir. Yes, and it costs you. Please, thank you so very much.
May we all stand for prayers? Our most gracious Father, we thank you for this time of being with one another and with you. We thank you, gracious Lord, for directing us in all things. We thank you for your grace. We thank you for your mercies. As we depart, gracious Lord, may we not depart from your presence. We pray, gracious Lord, that you bless us with journeying mercies. And Father, may your name be lifted up. For we are prayed in the name of the Father, and of the Son, and of the Holy Spirit. The Lord be with you.
Thank you so very much, Emeritus Professor. While we're standing, please let's take the national anthem, and right after the chairman's procession will leave. Thank you very much. The national anthem, preferably the second stanza. Let's allow the chairman 1 minute to leave the hall. Thank you very much. Thank you.
The members of the high table will recess the hall first, while every other person will be upstanding. Please permit me to recognize Mr. Henry Annie, Treasurer, Enugu State Sports Club. You're very welcome. We appreciate Members of the high table, please. Please, let's wait for members of the high table to recess the hall. Thank you, distinguished ladies and gentlemen.
Oh my God, oh my God, oh my God. When shall I see my home? When shall I see my native land? I will never forget my home.
Thank you all for making this event colorful. We wish you journey masses to your various destinations. God bless you all. I want to use this medium to appreciate my team, the public relations unit of the University of Nigeria and every distinguished panelist here present. We appreciate you for coming. God bless you all.
Oh my home, oh my home. When I shall see, when shall I see? Oh my home, oh my home, oh my home. When shall I see my home? When shall I see my native home? I will never forget my home. Oh, hey. Oh, my home. Oh, my home. I will never forget my home. Oh, my home. Oh, oh, my home. When shall I see my home? When shall I see my native land? Rababasaka ya Moronto Sogo ya Balage. My home, my home, my home. Sabasaike, oh, my home. When shall I see my home? When shall I see my home? I will never forget my home. Rakasa yo male, bamba sako ya sente. Rene baba malo sakaido, my kansa. Ramba saga ya bamalo kasempele santo. Rakama ye beselo yanka samina lo. Oh.